Good morning. I'm Dr. Allison Arwady, Commissioner at the Chicago Department of Public Health. Thank you so much for joining us this morning. As always, we are here on Facebook Live, ready to take your questions related to COVID-19 and other things that are public health related. Today is Tuesday, September 22nd, and as you can see, we have a guest with us. This is Dr. Candace Robinson, and we're really excited because she is one of our newer employees at the Chicago Department of Public Health. She's come in as one of our medical directors for communicable disease. She's a board certified pediatrician, and she has a long history of working in public health. So started off, at CDC, but also working in a state and local health department in Arizona, doing some outbreak response and other things there. And then for about the last 5 years, you've been at CDC working in immunization with something called the ACIP, which we'll hear about. And then, when did you start with us?
I started about a month ago.
Yes. So moved to Chicago in the middle of a pandemic, and we're so pleased to have her. Has really jumped in hard in terms of all of our planning for looking ahead to COVID vaccine and what we're doing differently around flu vaccine this year. So one of the things we've gotten lots and lots of questions about is related to vaccines, and I wanted to have you come on and just help answer some questions for people. So you can start putting questions in the box, either for Dr. Robinson or for me. Hashtag Ask Dr. Arwady if you're on Twitter, or you can just put them in the box below. We've also been getting some questions in even as we've been getting started, and we will be taking those in just a minute. So first, let's check our distancing.
Yep, I think we're good.
We're good. As always, this is your good way. Really important you're keeping at least that 6-foot distance, especially if you're inside. Obviously, you want to pair that with mask wearing, especially if you're moving around or not keeping distance, all of the hand hygiene, protecting vulnerable people, all the things we've been talking about. So just to kind of kick us off a little bit. So welcome. Thanks for being here. Tell us just a little bit about what this transition to Chicago has been like for you into this new role. It's always different to start a job, in the middle of any time, but then especially right now when we're at fever pitch to start with and then needing to plan.
Yes, no, it has been an interesting experience, to say the least, to move in the middle of a pandemic, I will say. But no, it's been wonderful coming to Chicago and wonderful starting here. I'm a Midwesterner originally. Yep. I was born and raised in Detroit, so Midwest, it feels like I've come back home.
Very
now.
Good, very good. Yeah. We like that.
Yes, so it's been great to start here at CDPH and to just really hit the ground running and start working on COVID issues, flu vaccine planning, COVID vaccine planning, getting to know the team here, which has been wonderful. Mm-hmm. So I'm really happy to be here, and it's really been great.
All right, great. And I know we're going to get a lot of questions, but let folks know just sort of big bucket some of the things that you're focused on and your team is focused on right now.
Sure. So some of the things we're focused on right now, first and foremost, we're getting ready for flu vaccine clinics that will actually be starting next week. So I'm sure we'll talk about that sometime during the course of this Facebook Live. So that has been the largest bucket we've been working on right now. And some of the things that we're doing for the flu vaccine clinics this year are a little bit different than what we've done in previous years here at CDPH. But we're hoping that these will help prepare us, and these activities will help us get ready for, when there will be a COVID vaccine available as well. So we've really been thinking a lot about flu, thinking a lot about flu clinics, thinking a lot about what we can do to help prepare and get ready for this.
All right, perfect. So we're going to take a second and look at our COVID data, which we always do, pull up the dashboard. As a reminder, you can get there directly by going to chi.gov/COVID-, or as always, for all things related to coronavirus, you can go to chicago.gov/coronavirus. So here, where we pull up the dashboard, have we got it up? All right. You can see, first of all, that our test positivity rate is finally coming down. We had been hovering right around and just over that 5% mark for quite a while here, and had set, that 5% test positivity mark is just an absolute for us. Like, we've got to be under 5% at that test positivity mark to even be thinking about the potential of relaxing some restrictions. And as we head into cold colder weather, of course, really important to have this in as good control as we can. So we're at 4.6% test positivity right now as a 7-day rolling average. You can see that's down from 5.1% a week ago. We also cumulatively on tests over the weekend passed 1 million tests that have been done in the city of Chicago or for Chicago residents. And so that was a big landmark for us. And you can see that our testing average is back up over 8,000 tests a day, which is good. That's where we've been. We saw a drop really over Labor Day weekend. That Saturday, Sunday, and then importantly Monday saw a big drop in cases. We were testing only maybe a third or even a quarter of the number of patients that we would normally test, and seeing many fewer cases also diagnosed as a result. So you can see that our testing, our daily tests are up 18% from last week as the average, and that's because we're sort of past that drop that we saw for Labor Day. And then our cumulative cases, we're now at a total of 77,500 cases of COVID that have been diagnosed in Chicago residents. We do estimate that is a undercount. We estimate there are probably 5 to 10 times, if I had to take a guess, probably in the 5 to 6 times as many patients of this has actually had COVID. But our daily case average is at 287 cases per day. That is certainly better from where we were back a few weeks ago, where we had crested really over that 350 per day mark. And where we correct for testing, we've been seeing that really coming down nicely. You'll see that a week ago, we were at 269, partly because of that drop of the testing with the Memorial Day numbers. But while our test average is up 18%, our case average is up 7%. So that's a good sign that we are absolutely seeing some good progress. And if we pull up over here on the daily demographics, you can see, first of all, in the graph in the upper right here, that right here, right around August 24 is where we peaked most recently in terms of our cases and our positivity. And then we've been coming down, slowly and steadily since then. Had this a little bit of an extra drop with the Labor Day, but definitely heading in the right direction. You can see we're averaging 3 deaths per day. We've been averaging 2 to 3 deaths per day, really very consistently here. Our hospital numbers continue to look good. Our person positivity is at 7.9%. So that's where, just as a reminder, test positivity is all of the positive tests that are done divided by all the tests that are done without any deduplication. So if somebody has had 6 tests, you count it 6 times. Whereas person positivity, you deduplicate and everybody is only counted once. So that person positivity, we also follow really closely, and it's the one that we use to compare across neighborhoods or to compare across race, ethnicity, or age groups. So that is still at 7.9%. I absolutely want to see that also coming down. It is also down from last week where it was at 8.2%, but we follow both the test positivity and the person positivity. So overall, feeling positive about the way that we are heading right at the moment. And you can explore further if you go to the weekly by zip. This is where you can see graphically really which neighborhoods. We continue to see cases predominantly focused, especially on the southwest side. If we look at our percent positivity for the last week, you can see that the southwest side is really where we're still seeing the highest in terms of person positivity, followed by the northwest side, especially in predominantly Latino neighborhoods. But we're seeing excellent progress also among Latinx Chicagoans. The rates there have been dropping the steepest that they have among any of our race ethnic groups. So we are making real progress, and I am very hopeful that that will continue as we, of course, are moving into some colder weather. All right. So maybe just the last thing I'll note is that we have now tested 1 in 4 Chicagoans, and that is Chicagoans. That's not just tests done. So again, we've crossed that million mark in terms of tests done, but we've tested more than 630,000 Chicagoans. So that is 1 in 4. So that's exciting. And we did have that first day without a death on August 31st. So that was a good landmark for us. Okay. So let's go ahead and there's one other piece of data that I wanted to just bring up that is not our Chicago data, but we got some questions last week, and Dr. Robinson, I thought you'd think this was interesting because, as a pediatrician, we think a lot about how changes in behavior related to COVID intersect with flu transmission and other childhood illnesses. And so there was this nice study that was published in Pediatrics. I'll pull it up. Can we get the graphic? It was published in the September 1st issue of Pediatrics, which was one of the big journals for pediatricians. And it pulled together 375,000 kids who were seen in Massachusetts in a primary care setting. And what this is comparing is the blue lines show you what the number of visits and diagnoses were for these common childhood illnesses. In blue shows you what week after week we saw the numbers look like in 2019, and yellow shows what the numbers look like in 2020. And so, for example, acute otitis media is fancy doctor talk for ear infection. And where kids are intersecting with each other and they're sharing their viruses, like, you know, these are one of the things that put kids at high risk for ear infections. And you can see the very severe drop that exactly overlapped in gray there, where we were moving into shelter at home. And so really seeing that across all of these things, the common cold, bronchiolitis, croup, gastroenteritis, which is like stomach viral infections, influenza is there, that we saw major drops because we all stopped having as much interaction. We all started wearing masks and social distancing, staying at home, and saw major changes in terms of what this looked like for kids. So, and interestingly, the only one on this list is UTI, urinary tract infections. Those are not spread person to person. And you see there's a little bit of a drop there in the yellow down on the bottom right, probably where people were not seeking as much medical care, but then that came back up as you would expect it to. So anything you want to add to this? I thought people would think it was interesting.
No, it's actually really interesting. And, like you said, as a pediatrician, I always used to say kids won't share their toys, but they share their germs with one another all the time. And so, all of these practices that we're putting in place to help with the spread of COVID helps with other viruses, the mask wearing. I've even seen, kids in the neighborhood wearing their masks, and even as they go outside and walk in the park. So it's actually really interesting to see it, even though we thought it would happen.
All right, great. So we're already getting a lot of questions in, but I'm going to take the prerogative and ask you, if you don't mind, sort of the first question, because, as somebody who worked in one of the federal agencies, worked at the CDC, there are different federal agencies that are involved in vaccine development, vaccine recommendations. Can you talk just a little bit about the role that these different, like what they are, the role that they play? I think it's something that can be really confusing for folks, and I'd like to help use some of your expertise to answer that.
Sure. I think when I think about the different federal agencies, I think of three big ones that are kind of involved in vaccines. I think of the National Institute of Health, or the NIH. I think of the Food and Drug Administration, or FDA, and I think of CDC, Centers for Disease Control and Prevention. They all play slightly different roles in this process, but they all have a big important role, I think, in this process. I would say, starting with the National Institutes of Health, or NIH, they really do a lot of work for vaccines, and they do everything from kind of the background research that needs to happen in the laboratory, all the way to helping with studies when we get to human beings. So, and that laboratory work is very important. That's kind of where they take whatever they're studying, let's say the virus, like a COVID virus, like a flu virus, and they kind of look at it. They want to figure out how that virus interacts with people and with our immune systems. And then they look at, what they can do and kind of evaluate, what parts of that virus and can they use to make a vaccine, and what would our immune system respond to give us the protection from that virus, but without giving us the symptoms of that virus or risking the complications that could come along with that virus. So they do a lot of that work. I would say the FDA, their job is to approve the vaccine.
Yes.
So it's kind of a three-step process, is the way they explain it. So the first step in that is when someone has a vaccine that they want to do clinical trials on, they have to go to them and put in an application and say, hey, we want to do these trials. And
so this would be like a company, for example.
This would be like a company, or whoever is researching this vaccine, a company,
a
university, research institute, whoever is researching that vaccine has to come to the FDA and say, we have this vaccine and we'd like to begin testing this vaccine. look at this information. And so the FDA looks at, any information they have about the vaccine. They review in detail kind of what they're going to do for those trials, the plans they have, the safety monitoring they're going to do, et cetera. And then once they approve that, say, yes, you can go into trials, they kind of go into the clinical trials. And there are 3 different phases, and we can talk about those a little bit later. But once they finish the trials and all 3 trials are done and they are deemed to be successful trials, then they actually put in an application to have that vaccine licensed. And so I think during that process, they actually have a board made up of multiple experts in different fields that look at all the information from the trials, and they actually even go and inspect the facilities where the vaccine is made, and then they decide whether or not, yes or no, they want to approve that vaccine to be used. After that process, if the vaccine is approved or given an approval, then this is where the CDC comes in, and through the body that you mentioned earlier, the Advisory Committee on Immunization Practices, or ACIP. The ACIP looks at all of this information. They get presentations on safety, they get presentations on how well the vaccine works, they get a lot of presentations on the vaccine, and then this group really decides what recommendations they should make with the vaccine. Now, I think it's important to note, it's 15 people, this group, and they are non-federal government experts in clinical medicine, in public health. There's always a consumer representative that may represent like a nonprofit agency or something like that for children.
So not government.
Not government, not federal government. They may work in a state or a local health department, but they don't work for CDC. These are people who don't work for CDC, don't work for the federal government. And they take all of this information and they listen to the presentations, and then they make recommendations for the use of that vaccine. What I think is interesting about their process, it's completely open. ACIP meetings are live streamed. So there's actually one going on today. So after you finish watching us, you can actually go to the website and log on and watch the meeting that they're having right now. But they're completely open to the public, and you can watch even old ones on YouTube. And then once they make recommendations, then they give those recommendations to the CDC director, who either says, yes, we're going to proceed with these recommendations or not.
Okay, great. So lots of different pieces fitting together. It can be like an alphabet soup, I think, for people who are kind of new to the space.
For me too.
Yeah, absolutely. So, there's been a lot of news about this Operation Warp Speed, right? This concept that we're trying to speed up the vaccine process. Can you talk a little bit, because I know this is something we also get a lot of questions about, what, from your understanding, has changed to allow the vaccine development process to go more quickly? How does that fit into all of these oversight and recommendation agencies that we've talked about? What does that mean for sort of a consumer on the ground?
Yeah, so I think, from my understanding, what they've tried to do with Operation Warp Speed is they've tried to take a process. Normally it has kind of step 1, step 2, step 3, step 4, step 5, and there's a lot of steps and a lot of things that have to happen, and they're doing some of those things that they can do at the same time. So for example, normally what happens is you have a vaccine that's FDA goes through clinical trials, and they wait until it's licensed, et cetera, to start making it in large quantities, because that makes sense. You don't really want to make a lot of something that may not work or be approved. Well, one of the things they're doing with Operation Warp Speed is that they are making some of these vaccines, the ones that look most promising, or the ones that look most like they're working and have the safety that we, would expect from a vaccine. They are making those at the same time as some of the later stage trials are going on. So that will kind of decrease that time period between approval and when the vaccine can actually go out. Another thing that they're doing is they are really working to set up the plans and the infrastructure to get the vaccine out quickly once it's approved. So that means, doing things like working with state and local partners, and just making sure that we're ready and we have kind of everything in place to get it done. They're making sure they have things in place. If you make a lot of vaccine, you need a lot of glass vials, things like that. So they're trying to do all the logistics. logistics, all the things that they have to plan to get it out to people once it's approved. They're trying to do some of those things at the same time as we're still going through the usual testing for where the vaccine works and the usual testing for safety, et cetera.
All right, perfect. So lots of good questions coming in. So I was just looking through them to try to group them a little bit and pull some things in. So let's start. Gail Waldock on Facebook. Will your department create and maintain a list of the various vaccines as they become available? Do you know where such a list can or will be found?
Yeah, so there are a couple of places where you can find information on COVID vaccines. Probably one place that has like the most comprehensive information would be clinicaltrials.gov.
Yep.
And they have all the trials, all the details about all the trials, et cetera. It can be a little challenging to find the information. So I went on, and the way I found it was through the home page. You can search by condition. I searched by coronavirus, and then I think you can type in a keyword vaccine, and it'll actually bring up all the trials for you. And these are trials that are happening all over the world. It's not just here in the United States. One place where they have that information kind of all pulled together and easier to kind of see them all in one place, I think, is the New York Times.
Yeah, I agree. The New York Times has done a great job pulling together a lot of this information.
Right.
I've been really impressed by them too.
Yes, they have a website that really talks about all the vaccines. It kind of has a vaccine ticker at the top. It tells you how many vaccines are in each phase of trials. And it also includes vaccines from all over the world, not just from the United States. So that's a place where you can find it kind of all in one place.
Yeah, and we will, to this thing of will we create and maintain a list, certainly once there are vaccines that are actually approved and recommended, we will absolutely be being clear about which those are. We're actually, I really want, and I know you share this, to make sure that we are being very transparent about the work that has been done to get a vaccine to approval. So we will have a sort of a local group here of providers and others that will look at this data, that will be able to sort of say, we take these recommendations because we will be able to say, literally, here are the results of the trials. And those will be publicly available, right?
Yes, absolutely. Those will be publicly available. And, even like I said, as ACIP discusses this information, they discuss this data, that's also available, and you can tune in and you can watch it on YouTube later.
Yeah, and I think it's a good idea actually to, that we may, particularly as we get into COVID vaccine, I know there's going to be a lot of interest in this, and I think we may think about, linking to the ACIP streaming, for example, on our website, and, I'm very interested in making sure that this data is transparent and available, and that when we're sort of as the Chicago Department of Public Health making recommendations, when I myself make a decision to get a vaccine, I know where to get the information to know what that testing has been like, to have that confidence. And I do want to make sure that that's as available as it can be and really based in the science. I know there can be a lot of noise up here about vaccine, but the actual recommendation will be based in the trials.
Right, yeah, absolutely.
Okay. All right, so we're getting some flu shot questions in too, which is good. So at Susan Hanna on Twitter is wondering, will you be offering drive-through flu shots?
So we have some Chicago flu clinics that will be happening, and they actually start next week and will go through middle of November. One of those sites will be a drive-through site. The rest of them will be kind of a more traditional clinic, although we have, of course, placed importance on social distancing, making sure we have the space for everybody to be there, making sure everybody has a mask on, or we give you one when you get there, but making sure everybody is masked. We have the space and the distance. There is one of those clinics that is going to be kind of a drive-through model, so that we can, work on that logistically. I think when a COVID vaccine is available to most people, we need to be able to get people vaccinated quickly. But most of our clinics will be more traditional clinics where you come inside and you come in and sit down and somebody will provide the vaccine. But we are testing that drive-through model in one location.
Yeah, and we're really trying to use our flu campaign this year to trial some different administrative and practical things because we don't usually launch a big vaccine campaign in the dead of winter. Like that's unusual for us.
Right.
And so, everything from, and you'll be hearing more about this, where the city is offering flu shots, we're going to have a pre-registration platform, which will probably model what we'll want to have in place as much as possible for COVID. We'll be trying to do this in a paperless way. We'll be thinking about how are we pulling some of that information and sharing it out. We're trying, again, different models. Normally you say come one, come all, flu shots for everybody. That is not the model that we are going to want for COVID, right? We're going to want this to be careful in terms of the spaces that we're in and making sure that we're thinking about social distancing and safety and all of that. So the clinics that the city itself is going to be offering, we are trying some different models to see what kind of staffing you need. What are some of the logistics of transporting vaccine? How do we keep track of this so that we're as prepared as we can be heading into an eventual COVID vaccine?
Yes, that's absolutely right.
We're getting some more questions about kind of where are flu shots available, et cetera. So I'm going to take the first stab at this one. First of all is that we really would like you, first and foremost, to get your flu shot with your healthcare provider. That is the best place to get it because it also offers us an opportunity for you to check in on all of your other, whatever chronic diseases you may have for children to make sure they're up to date with their regular vaccines. You're developmentally on track. You're getting that done in a well child check setting. For adults, it's an opportunity to make sure that if you're having an appointment, you're getting a physical, things like your blood pressure and your cholesterol, or if you have diabetes or asthma. We want people to be in as good of health as they can be heading into the fall and winter. And one of the best ways to do that is to make sure that you're connected to a healthcare provider, and getting your flu shot through that provider is one of the things that we're really emphasizing. So first and foremost, get it through your provider if you have one. If you don't have one, there's information on the CDPH website about how you can link up to federally qualified health centers, for example, or if you're insured, if you look on the back of your insurance card, there will be a website or a phone number that you can call and they'll help you get set up with someone who takes your insurance. But secondly, in addition to getting it through your clinical provider, is you can think about getting it through your pharmacist or through a pharmacy. Do you want to talk a little bit about sort of the pharmacy piece of this?
Yeah, sure. So, a lot of times at a pharmacy, and it depends upon, the pharmacy, but and with most insurances, you can get a vaccine at your pharmacy at no cost to you.
Yes.
Pretty much always. You can just walk in, show your insurance card, and they will take it from there, and you just get vaccinated there. So that's another great place if you have an insurance card available to go get vaccinated as well.
Yeah, and I would add to that especially as we're looking ahead again toward COVID vaccine, the city of Chicago will certainly be offering COVID vaccine, like through large clinics. We will likely have clinics set up, for example, through city colleges or through large spaces. But that is only going to be a relatively small part of the actual full vaccine effort. And particularly as the year goes on and more vaccine becomes available, we will absolutely be partnering with healthcare partners, and pharmacies will be major places for also getting COVID vaccine. So part of the push to have people get their flu vaccines now, through first and foremost your provider and secondly through your pharmacist, is that these will also be modalities. And for example, just this week, the Health and Human Services changed at the federal level that pharmacists can give vaccine, including flu vaccine, to children all the way down to the age of 3. Now, if you have a 3-year-old well child check, better to go to your pediatrician to make sure you're up to date with all the other things. But some of that broadening of scope is looking ahead toward COVID vaccine.
Yes.
So. Anyway.
Yes, I agree with that.
Yeah.
We're working very hard to work with all of those partners.
Yeah, and we really, Walgreens and CVS and the smaller partners will be a huge piece in all of this as well, and they're very good places to also get the vaccine. All right, so let's take some more questions. So Glenda Lynette Baugh Johnson on Facebook is saying, if you get the flu, and she's also wondering about pneumonia inoculations or shots, what percentage of coverage do they provide?
So That's a good question, and it really varies year to year, and here's why. Every year, the flu particularly changes a little bit. The flu virus itself changes a little bit, and what we do with the vaccine is we try to figure out what flu virus, what version of that flu virus is going to be circulating around in the community that year. And so that's why you'll see every year the flu vaccine itself changes a little bit.
That's why you need one every year.
That's why you need one every year. And sometimes, that estimate of which one is going to be floating around that year is really good and lines up really well with the vaccine. So in those years, the vaccine is much more effective in preventing flu. And then some years it's not as good of a matchup and it's a little less effective. In recent years we've tended to have, it also varies by age, interestingly, how effective it is. It actually tends to be more effective in children, and they'll have higher effectiveness rates as well. But it really varies. In the recent years we've had kind of high 60-ish% efficacy for the flu vaccine. What I also think is important to note about the flu vaccine is that if you get the flu vaccine, not only could it prevent the flu vaccine, but if you do happen to prevent the flu vaccine, yes, prevent the flu. But it could also, if you do still happen to get the flu, it could lessen the severity of your illness.
That's the one I really care about the most.
So if you still, if you get kind of that version of flu that doesn't exactly line up with the vaccine you got, you can still have a less severe illness than if you didn't get the flu vaccine, which means you can stay out of the hospital, you can stay home, you may not need to see your provider depending upon how your illness is doing. So that's another important piece to getting the flu vaccine that I think sometimes we don't talk about as much, which is also very important.
And particularly where we look at this fall and winter, we're concerned about our healthcare system, right? Where every year, if you work in a hospital, July and August are very light in hospitals. They tend not to be very busy. When you are in January and February in hospitals, leaving aside COVID, that is when hospitals really tend to be bursting at the seams. And a lot of that is driven by flu, by influenza admissions, and many of these other respiratory viruses that circle much more during the fall and winter. And so knowing that our hospitals are going to be comparatively full based on prior years, even if we get off with a little bit of a lighter flu season, which we're hoping for, anything that helps keep people out of the hospital, and first and foremost, getting that flu vaccine, the fact that people, even if you are not completely prevented from symptoms, it is very helpful in terms of stopping hospitalizations and stopping deaths is going to be really key. So that is another big reason this year to get it.
Yes, absolutely.
Yeah. Okay. Joanna Dovidoskis Doria on Facebook is wondering, where can children go for flu shots? The drugstores only give older children. So right. So that was literally like just in the past few days that the decision was made at the federal level that it can go down to age 3. But still, first and foremost, if you've got a younger child, my strong recommendation is bring him to the pediatrician. And many pediatric offices, including here in Chicago, are setting up separate flu clinic settings, and again, thinking about social distancing. I mean, everybody's being careful about how to do this, but we really want, everybody over the age of 6 months, with very few exceptions, needs to get a flu vaccine every single year. But we're especially interested in making sure children, older adults, people with underlying conditions are getting it. So,
yep, I would echo that.
Yep. Okay, so Dave Waite on Facebook is wondering, with cold and flu season coming, what differences are there, I think he means between COVID and flu, so someone could know they only have a flu or a cold and not COVID? You want to start that?
Yeah, I could start that. I think, that's the hard part. Sometimes, some of these symptoms are very similar amongst flu, amongst COVID, amongst colds. So you can use symptoms a little bit to tell, but part of it is you may not know. And so you really want to act like you have COVID. If you have symptoms of COVID, if you have cough, if you have fever, if you have COVID, some difficulty breathing, you want to act like you have COVID even before you know. You want to make sure you're staying distant, you want to get tested, you want to call your healthcare professional, and you want to seek care that way. So you may not know, and unfortunately, it may be hard to tell.
Yeah, and that for me, like, you gotta get a test. Like when it comes right down to it, you are not going to be able to look at somebody's symptoms and know whether that's COVID or flu, and particularly assuming that we continue to have at least this level of COVID circulating in Chicago. It's COVID until proven otherwise. Another good reason to get your flu vaccine, because it decreases, the risk that you can get flu. And all of the hand washing and mask wearing and social distancing that we are doing for COVID will also help with these other symptoms. So I'm hoping that this year, will be a lighter year like we saw during stay at home, right? That is behavioral change, and all of that, the decrease in the influenza and the ear infections and the other viral infections among kids. That is all a result of the things that we're doing to keep us safe from COVID. We keep doing those things through the winter. Hopefully we will see less of this, and then we'll have fewer people worried because they or their children have symptoms that you're not going to be able to tell. Okay, lots more questions. So Latanya Williams on Facebook is saying, if the flu shot is not 100% or 80% effective, why should we trust this so-called COVID vaccine?
So I think we'll have, we don't know what the COVID effectiveness will be quite yet. And vaccines in general range in effectiveness. Yeah, the most effective vaccine is probably, the measles vaccine, which is like 99% effective. All vaccines kind of have a range of effectiveness. And so what we have to wait and see is what the COVID vaccine effectiveness will be. Now, what's important to note is that, even if a vaccine is not 100% effective, even if everybody who gets the shot doesn't get protected, when you protect more people, there's less places that virus can spread. And so there's less people who can spread it on to other people. It's a concept we call herd immunity. It's when people are immune to the virus has nowhere to go. If I'm immune and the person next to me has it, it can't come to me, so I can't take it to the next person. So we don't know the numbers yet for COVID vaccine. It's something that when we get the information, like Dr. Arwady said previously, we will be as transparent here at CDPH, and we'll say, here's what the numbers are, here's what the studies have shown, and we'll present that information to you.
And I think Latanya's question is really important, because I think there are people who assume that a COVID vaccine will be 100% effective, that every single person who gets a COVID vaccine will be 100% protected from COVID, and that is just not likely. I think if we got a COVID vaccine that turned out to be 80% effective, or even had the important effect like the flu vaccine does of making even people who get symptoms much less likely to get hospitalized or to die, that would be a vaccine that would be approved, assuming that the safety profile was good, of course. And so even as we are rolling out this COVID vaccine, probably over 2021, there will continue to probably be additional versions of the COVID vaccine. Like, we're going to keep working on this, and it could be that an early one turns out to be very, very helpful and effective for older people, and maybe a later one could turn out to be more effective for younger people. We just don't know yet. But vaccines will be approved when their safety profile, first and foremost, looks good, and secondly, when they are shown to be effective, especially against preventing against severe COVID. So I think it's a really good question, and one that we'll keep talking about as these trials move forward and as we have data from them to show. Yvette Smothers on Facebook is saying, it's sort of a comment, but I think it's a good one to address. She says, they don't talk about the side effects that the vaccines have in some cases. Can you comment on that?
Sure. So I'll say first, for COVID vaccine, we don't know the side effect profile for COVID vaccine yet. And that's more information that we'll get as these vaccines the studies finish and they begin to publish that information. For flu vaccine, most side effects are mild. You can have redness, soreness, tenderness at the injection site. Some people get fevers, some people get a little bit of headache, etc. But those symptoms are usually mild and usually go away on their own. In rare instances, you could have a serious side effect. So I think they did a study about 1 in every million doses of flu vaccine, somebody could have a serious allergic reaction to the flu vaccine, or to any vaccine, any medicine. So that is possible. And so there are possible severe reactions to flu, but they're very, very, very rare. 1 in a million doses, I think, was the most recent estimate for a severe allergic reaction.
Mm-hmm. And there are processes in place for where there are these sorts of reactions. As a doctor, as a practicing doctor, and you too, you actually have to report in, even after a vaccine is done. If you have an event that may have even been possibly associated with a vaccine, those get reported in, and that will be true for any vaccine where you sort of follow it on.
I wanted to say, I think it's important to note for that process, you as a vaccine recipient can report something if you think it happened after the vaccine. There's a system called the Vaccine Adverse Events Reporting System, or VAERS, and you can just Google it. And you, even as the patient, can report something that you think may be related to the vaccine.
And a couple other things. One is that when these trials are initially happening, like the phase 3 trials happening for COVID right now, this same process was used for all of our approved childhood vaccines. We've got 18 basically childhood vaccines at this point that have very, very, very good safety profiles. And every time, like as a pediatrician or as an adult doctor, that you give a vaccine, there actually is there's a form that is supposed to be, you should be receiving this. If you're not receiving it, ask your doctor or your pharmacist, because there's an approved form that actually talks about this, that talks about what do we know about potential side effects, what should you do. There's a separate one for every vaccine that we give routinely, and so that is, ask for the vaccine. It's called the vaccine information sheet. Ask for it, and that is a way of making sure that anybody who is getting a vaccine is getting the information that we know about that vaccine. So I think, I always actually, as a pediatrician, and as an adult doctor, when I'm giving vaccines, I try to take the time to talk with the patients. Do they have concerns? Do they think the flu vaccine can give them flu, which it cannot? We sort of talk about that. Or, for any of the childhood vaccines, make sure people understand, what this vaccine is being given for, what that safety profile looks like. But the thing is, vaccines, different than clinical medicines, clinical medicines are being given to people who are sick and who have a disease, and you will sometimes tolerate some more side effects with a clinical medicine. For example, chemotherapy, right, can have a lot of really bad side effects, but chemotherapy medications get approved because they are needed to actually treat the underlying cancer. The difference is that vaccines are given to healthy people by and large. And so any vaccine that is found to have a significant, any concern for serious side effects would not be approved. And in fact would be removed from the market if it was found after the fact to have any kind of significant risk for serious side effects. So the standard of evidence for a vaccine and the need to look at those side effects is really different. So we will make sure, certainly as we are sharing out, as COVID vaccines are approved, or for any of your other vaccines, there are information sheets to make sure that you are getting that information, because I want people to have that information as they make decisions.
And I think something you touched on, Dr. Arwoody, was very important, is to note that just because a vaccine has come out and has been released, we still watch, they still watch the safety of these vaccines. They still review the reports. There are still other mechanisms that are used to monitor safety even after they've been released. So we don't just release it and say, it's done. We still have to watch and make sure that, this vaccine is still safe and performing and working the way that we expect it to. And if they find something that, like Dr. Arwoody said, what we call like a safety signal, where there's of concern, or there's a concern about how well it's working, then the recommendations for that vaccine may change. So it's not a one and done. We still look at these things over time.
Yeah, absolutely. All right, lots of good questions today. Really appreciate, again, if you missed the beginning, this is Dr. Candace Robinson. She's one of our communicable disease medical directors at the Chicago Department of Public Health. Has a lot of experience working in vaccines and immunizations, including at the federal level before coming to us just last month. And so you will continue to see and hear from her as we push out more information related to flu vaccines and to the upcoming COVID vaccine. So thanks again for being on. Is there anything, we usually end with, good news or things for people to look for? Anything else you want to add?
Good news. Well, I think good news is we're supposed to have some nice weather this weekend.
Yeah,
so.
That's good news.
Have your socially distant, mask-wearing walks outside. Make sure you get out and have some fresh air this weekend. I'm coming from the South, so I'm preparing for my first Chicago winter. So I'm going to enjoy the warm while I can.
Absolutely. Perfect. I will just, in terms of some, maybe it's not good news, but it's things that you can do. So one is we are having a press conference today at 1 p.m. where we'll be giving updates on the travel order and talking a little bit more about COVID-related news in a more public way. So you can tune in for that if you like. You have 9 more days for you and your friends and everybody you know in Chicago to fill out the census. The end of the month marks the end of counting, and every person who fills this out in Chicago means that Chicago gets more federal dollars, more federal representation, and this is the data that CDPH uses to calculate things like disease rates. So it takes less than 10 minutes, 2020census.gov. Please put it on your Facebook, share it with your friends. We want everybody in the US, but especially here in Chicago, filling out their census, and we're running out of time. We launched Healthy Chicago 2025 successfully last Thursday, so if you missed it, you can go to chicago.gov/CDPH to learn more about that and see the book and watch the launch. And then finally, we've got a new survey up for 18 to 29-year-olds on chicago.gov/coronavirus. We've got a young adult survey interested in your ideas, your experiences, as we continue to really work on getting messaging out. So please share that and fill it out. And with that, we will be back Thursday at 11 a.m. for our normal COVID questions. Sybil Madison will be back with me, and we will have time to get into some other aspects related to COVID. So thanks again so much for joining. Thank you, Dr. Robinson. Be safe, Chicago. We'll see you on Thursday.